Hey everybody, this is Blake Head with iSalis. I just wanted to let you know we're going to wait just a couple more minutes. It looks like several people are trickling in right now, but we will get started here very shortly. Thank you. All right, we are going to go ahead and get started. So once again, thanks for taking some time today to jump on the meeting and learn a little bit more about our intelligent intake solution offered through iSalis. Before we really kind of dig in, just want to give everyone a heads up. You will be muted, excuse me, you will be muted for the duration of the call. But at any point in time, feel free to ask questions on this GoToWebinar panel, probably hanging on the right-hand side of your screen. You'll have the ability to ask questions, and we'll be sure that we address all of those at the end of the presentation. So to go ahead and jump right into this. So I want to talk about big picture, what the intelligent intake is and why we think this is such an important feature for just about every single practice to have. So it's no secret that every single practice has some sort of intake process, right? Patients have to come in, they're going to have certain appointments, and based on that appointment, there's going to be some level of information that the patient either needs to complete or review. And the real tricky side of that is the fact that every single patient is different, right? Based on your age, based on your demographics, based on what you're coming in for, what you've done in the past versus what you're needing to do today, all change. And what we've tried to do is build in all of the intelligence that a human might typically have to make a bunch of decisions and decide which paperwork to hand you and so on. The intelligent intake process really takes care of that. And then through technology, it allows patients to complete a lot of this work independently of the practice. So you're going to see how patients can actually complete all of their intake paperwork ahead of time, or if your practice would like to have the patient still complete the intake information in the office, we're going to talk about that solution as well. So big picture, that's what we're going to be going through. And I think you're going to very quickly see how this could easily boost the productivity of the practice. You're not having to make one-off decisions on every single patient and decide what forms need to be filled out when. You're also going to see how this can optimize your revenue. One of the biggest challenges that practices have is collecting patient payments, especially once that patient leaves the office. We have integrated the payment collection process as part of the intake as well, so we'll look at that. Obviously, we think this improves the workflow, so the less manual work that your team has to do, the better. So we'll look at how this eliminates some of that friction. And patients and staff are usually highly satisfied by a solution like this, right? If I'm a patient and I can complete a bunch of paperwork ahead of time so that when I get to the office, I don't have to kind of sit through that rigmarole and complete all that information on paper and wait through that process. That's a huge advantage to me as a patient. And then on the staff side, you're not having to basically transcribe work that was written down on a piece of paper. We eliminate all of that. And that's done really with 3 kind of simple steps throughout the entire process. There's basically going to be a way to assign intakes, right? And there's a couple different mechanisms by which that can occur. Once that intake gets assigned to the patient, then they're going to complete that intake. So they're going to go through whatever questions you've requested them fill out, make payments, and so on. And then at the end of that process, once they submit that to you, that information is going to automatically come back into the chart in one of 2 ways. It can be either, come into the chart and basically be sitting in a holding pattern and it needs to be reviewed by the staff, or some pieces of information can be auto merged into the chart if you'd like it to do so, right? And we'll go through all of those details here momentarily. And for those of you that are number nerds like me, for what it's worth, I just pulled some numbers yesterday. In May of this year, we had 133,000 of these intakes completed by practices across our entire platform. And based on the research that we've done, we know that it typically takes anywhere between 20 and 30 minutes of man effort on your practice's part to go through a normal paper-based intake that's not integrated into a solution. So based on that, we've actually recognized basically 2.6 million minutes of man hours saved by practices, which, again, if you're doing the math like me, that's about 44,000 hours, which equates to 1,800 days of work that doesn't have to be done by a member of the practice anymore. It can essentially be offloaded by the patients through this electronic process. So we're really excited about giving your practices the ability to increase your workflow, increase payments, and so on. So without further ado, I'll go ahead and jump right into the presentation. So where I want to start is actually in iSalus. So basically the entire process, or at least the majority of the process, is going to start by scheduling an appointment. So once a patient gets an appointment scheduled, part of the intake can basically automatically assign the correct intake paperwork to that patient. All right. So if I'm a patient or if I'm a practice over here and I want to schedule Blake or Ben for an appointment, I'm just going to go ahead and do so here like you normally would. So let me go ahead and just search for Ben. We'll go ahead and say he's coming in for let's just say a new follow-up appointment at our corporate office. Say okay, and that appointment is now scheduled. So the very first thing that has just now happened is we've automatically assigned an intake based on the type of appointment that the patient is coming in for. So let me drill into that for just a second. So this appointment type right here, all of these appointment types that you have custom built for your practice can be assigned an intake. So if you think about it in the terms of, if a patient's coming in for a new patient visit, you've never seen them in the practice, there's probably lots of stuff you're going to collect, and there's going to be some things that you can't collect. For new patients, it's going to be common to get all their demographics. You want to get all their medications the first time. You want to maybe fill out their history questionnaire, start to finish. You want to go ahead and collect a copay, but you might not, for example, know their outstanding balance. So you wouldn't want to ask that as part of this intake. You might want the system to be smart enough to know what forms the patient needs to fill out for a new patient versus a follow-up versus maybe a patient coming in for a surgery or some sort of in-office procedure. Those things are going to change by appointment type. So that's kind of the first thing to know, is that the intakes can be auto-assigned based on the type of appointment that you select. And those intakes, and we'll dig into this momentarily, can really vary quite drastically from appointment to appointment. Okay. The other thing just to know, and we'll go through this a little bit later as well, you can also manually assign an intake to a patient. So if for whatever reason you have a one-off scenario where you know you want this patient to complete this particular intake form, for one reason or another, there's ways to just ad hoc assign those intakes as well. Okay. But generally speaking, I've gone ahead and I've created that appointment, which is auto-assigned that intake. Now, once that intake gets assigned, we will automatically start sending communications to the patients based on preferences that you set up to remind them to complete their intake. So they'll get an initial email saying, hey, you've got this new intake, log into your My Medical Locker account and complete that there. And then if they don't complete that within a certain amount of time, we'll start to send incremental follow-ups every couple of days, again, based on your preference, reminding the patient to fill that intake out via the patient portal. All right. So if I happen to be a patient that has a My Medical Locker account and I do in fact want to go ahead and complete this information at home, I'm going to do that from the My Medical Locker application. So if I were to sign into My Medical Locker right now, you can see that for this particular patient, I now have one new form for me to complete. Again, that's automatically assigned based on that appointment. So as a patient sitting at home in my living room, a couple days before my appointment, I can go ahead and open up this form. You can see that it's a brand new intake. I haven't started working on it yet. It's called the new patient intake, and here are the instructions that your practice has presented to the patient for this particular intake. Okay. When I click on that, then I'm brought into the experience to start filling this information out and or updating it basically for this particular point. So the first thing that's going to happen, and the first sort of challenge that comes up with a patient filling out intake, especially in the paper world, is the fact that they have to repeat information that you already know about them. You know, they're rewriting their name, they're rewriting their address, they're rewriting their date of birth on multiple forms. That 100% goes away with a process like this. At the very moment that I open up this intake, what we do is we go out and we sync all of the information down from OfficeEMR, so from their electronic medical record, and we bring that down to the intake form. So patients aren't having to fill out things that are known or that are unchanged. Okay, so you can see that as part of my intake, I've been asked to fill out these sections. All right, so demographics, responsible party, my emergency contact, and the list really goes on and on. The first thing for you to really know or think about for your practice is the fact that these intake sections are what are going to commonly change from one patient to the next. So again, I mentioned these intakes are assigned by the type of appointment. If I'm a new patient coming in, I might have a big long list like this. If I'm a follow-up patient coming in, my list could be shorter or it could be longer if needed for your practice. And if I'm coming in for a surgery, this list could look wildly different as well. Okay, so just be aware that this list is going to change patient by a patient, and that is intentional. Now, as I start at the very top, all right, I'm in demographics and you can see all the fields that I'm being asked to fill out. The first thing that I want to point out sort of section by section here is that you get to control this entire experience, both the list of things that they fill out here on the left and inside of each one of those sections, what you are asking the patient to fill out and what you require the patient to fill out. So for example, I've allowed the patient to update their name. I may not want that and I may turn that off. I may ask them to update their date of birth and I may make that a required field. I get to control that intake by intake to really meet the needs of my practice. But you can see for this patient, Ben Jones is my name. I go by Benny. That all looks good. I don't need to change a thing. Here's my address. This all is fine. This looks good. I'm still a white male, but let's just imagine I moved for a minute. So if I move to 7826 Drive, 46237, okay, and that's all that's changed, then I simply confirm this section. It's saving as I go from one section to the next, so nothing gets lost in translation, and then I'm automatically taken to the next category. So one of the other things that we allow patients to fill out is the responsible party information. So they can say, you know, I am my own responsible party, so I just click this, or you know, maybe my father or my spouse or somebody like that is my responsible party, so I can say another individual and fill that out. All right. Same thing for emergency contact. I'm controlling which fields are available. I'm showing what's already on file. Maybe I want to provide Ellen@jones.com is her email, and she is my spouse. Okay. And I could add another one. He can pick up my meds. He's my father. Okay. So confirm that, move on. So the next thing that we have the ability to do is allow a patient to capture a photo. So that could be a headshot like you see here, or that, which is more common, is a picture of the patient's driver's license. So rather than the patient coming in and, you know, one of the common things that you have to do is take that driver's license from the patient and scan it into your system, they could basically take a picture of that and that would then be automatically merged into the patient photo section inside of iSalus. We do the same thing for insurance cards. So you can prompt the patient to take a picture of their front and back of their insurance cards, both primary and secondary. And again, rather than scanning those in when the patient comes in, they can be collected ahead of time. So everything that we just looked at was really kind of sort of front desk in nature. Some of the other things that we're about to move into are going to be more clinically based items. So you can see, for example, I can also add and modify allergies. So currently I have penicillin as an allergy on my chart. If I went and looked at this patient in the EMR, penicillin would be one of their allergies. If I, for example, have just recently found out that I am allergic to Lipitor, I can go ahead and add that to my list as well. Same thing with medications. Here's the current medication list that I have. If I'm no longer taking Cipro, maybe I stopped that, but I did start taking Tylenol, 8-hour, 650, add that, right? That's going to be added and the clinical team is going to have the option to review that later on. The next section that we are moving into is our history template. So as you're probably extremely familiar, in iSalus, you've got a number of customizable templates within your database that allow you to collect the clinical information that you need to document a visit appropriately. And really, templates kind of take up two types of information. There's historical type templates, where we're basically only updating information as it changes. And then there's also encounter-based templates like review of systems or questionnaires or things like that that you want to ask every single visit. The intake supports both of those. Right now, I just have the history section set up. So you can see which history items I have available to me as a patient. Now, another thing that's worth mentioning is that this may not mirror the history template that's in your database one for one. What we allow you to do is create a patient-facing version of the history template, and those details get mapped back to your sort of EMR template that your providers would fill out. So there's a lot of questions that you may not want patients to have the ability to see or respond to. There may be things where, you know, maybe a patient knows a heart attack by the word heart attack, but you call it an MI inside of your history template. Well, we can put the patient-friendly language on the history and then or on the intake and allow that to map to the appropriate item in your template. So if I've recently found out that I've got some kidney infection issues and I'm now smoking a pack a day, and it's gone on for basically this COVID thing for about a year now. Okay, I'm also a current drinker, and I've moved to just straight, I'm just doing it all. Beer, hard liquor, and wine. COVID's been tough, okay? So we get all that filled out and we go to the next section. The next section that we have is preferred pharmacy. So this is a newer feature that actually got implemented probably 2 to 3 months ago, where we now have the ability to essentially capture what the patient's preferred pharmacy is. So you can see that I go to both Express Scripts and CVS. We can add more. So if we have a Walgreens on Emerson in Indiana, all right, we didn't find any there. Let's just see Walgreens on Emerson. Apparently there's not Walgreens on Emerson. All right, grab this. And that is now going to be a new preferred pharmacy that I go to. The next section that we're moving into are letters, or basically things that you want the patient to sign. Consent to treat, privacy policies, HIPAA policies, whatever those documents that you want a patient to sign, you can have those things available and allow a patient to review that information and then ultimately sign that document. Okay, so they can type their signature in, or they can use their finger to draw that. Okay. One of the great things about the letter side of this and sort of the intelligence that's built into the process is the fact that we know that not every letter needs to be signed every time. So for example, if you have a consent to treat and you're coming in for a surgery, you probably want to make that required every time. But if you have a privacy policy and you know that that only needs to be signed once a year, the system's smart enough to know that, okay, we've already signed this. We don't need to keep presenting this information to the patient, okay? So we can just have them fill that information out as needed, okay? I'll go ahead and sign this last one. I'll just type this one in, okay? And move on to the next section. The next section that we have is the ability to make payments. And there's two ways that payments can be made. Co-payments can be made, or outstanding balance payments can be made. So I actually have assigned this patient a new patient intake. So for new patients, we expect to have a copay, but we don't expect to have an outstanding balance. On my follow-up intakes, I probably would have another section down here called outstanding balance. We would present that patient outstanding balance to them, whatever that dollar amount was, and allow them to pay via credit card. In this case, it's just the copay. So this is looking at the patient's primary insurance that you have on file and the copay amount that you have in that copay field, and prompting the patient to make that payment. So if you're using, this requires the credit card integration to be activated for your practice. So if you signed up with PaySimple to accept credit cards, this becomes an option for you. So they can just simply hit make a payment. If they had a credit card on file, they would be able to select it from here, or they can add a new one, enter the details, hit pay. That's going to push that money to your bank account, but also put the appropriate receipt in the billing system for either a copay or a general payment, all right, based on what they're paying. And then once they're done, they go to the very last section and submit that form. Okay, so that's how a patient would be able to complete that information at home in the comfort of their living room prior to coming into an appointment, right? So that's how, so that's one workflow that exists. The other workflow that I want to kind of talk about before we look at reviewing this information is actually an in-office workflow. So we support basically patients coming into the practice. You know, they didn't fill out the intake at home, or maybe they've started at home but didn't finish it. Either one, we know we need to get the patient to fill this information out while they're in our office. Okay, and in doing so, most practices will have iPads that they can hand to the patient. So this is really formatted to work really well on iPads, but this can technically work on any device. If you had a couple computers sitting in the corner to allow patients to go to, that would work. But iPads seem to be the most user-friendly situation here, okay? So imagine we've got Mary coming into our office. Okay, we can basically assign Mary to complete the intake via an iPad. So if I had an iPad sitting behind me, I would pull it out and go through the assignment process here. And there's two ways to do that. You can do it right as part of the check-in workflow. So if I check this patient in and our quick pay window comes up, we can actually go ahead and click intake assign. It's going to find any forms that she needs to fill out. So we can see that we already have one assigned to her. So we would hit start. This gives us basically a key that we can plug into the iPad. Now, use your imagination with me for just a second. Imagine this little screen over here is my iPad. So we need to punch in this code. So DX6 406 406 195. Okay, so that should be the code to basically unlock this patient's intake. Now, the other thing that they have to fill out is their birth date. So what we recommend is actually handing, after the practice is put in this code on the iPad, hand the iPad to the patient, ask them to put in their date of birth. That way you're not, it's one additional check so that patients aren't unlocking information that isn't really theirs, right? You could have accidentally given this to the wrong patient or had this up. This date check verifies that. So if I'm the patient and my birthday is 11/19/1937, I'll go ahead and submit that. It's going to validate that this is a real intake. Date of birth's correct. It's going to bring down all Mary's information. So you can see this is obviously different than the patient we were just working on. And then I'm going to work myself through the entire intake process. Looks exactly the way the other one did from My Medical Locker. It's just we remove all the extra My Medical Locker stuff. You can't go looking at your appointments. You can't go, looking at statements and lab results. You're just really kind of focused in on this one little form. Okay. So if I were Mary, I could start stepping through this and filling this information out as I see fit. Okay. And then obviously, just like the other one, we would get to the end and submit that form. So those are kind of the two variations of how a patient could ultimately complete this intake, sitting at home or sitting in your office with an iPad or some other device to access this. Okay. So jumping back over to iSalus, there's a few things I want to show you while the patients are completing these things, especially when this is happening in your office. So you can see right from this intake assignment window, we know that this is in progress. We know the patient's working on the iPad. We can see that she's 25% done based on the status. So every few seconds, this will update so you know where she's at. She already completed all of the required fields, and she didn't make any payments quite yet. Okay, so this is giving you sort of a summary for this one patient where they're at. Now we have the same type of view available and more of a pop out for your entire practice. So if you wanted to see all of your patients and where they were in this intake workflow, you can open up the intake schedule. So if I had 100 appointments today, I would have 100 patients on this list in various stages of being complete or not complete. So once they finish that, then those forms go into the forms to merge section where we can review changes they made. Once we accept those changes, then it goes into the completed section, okay? And how that flow is all based on some settings that I'll dig into just a moment. Okay. So that is how patients complete the intake. The very next side of this is reviewing the information that was ultimately completed by the patient and merging that into the chart, right? And like I mentioned, there's several different ways to do this. Practices will want varying levels of control. So for example, maybe I want all of the front desk type information to be auto merged. So if they change their demographics, their emergency contact, their responsible party, they sign some letters, I'm just happy with that. I want all that to just update the chart. I don't want to have anyone have to review that. However, if that's not the workflow that my practice has dictated, I would be able to, in fact, review those changes ahead of time and either accept or deny those things into the practice, okay? Same thing happens with the clinical information. So if I go ahead and open up this patient in the EMR, okay, so within the EMR, what would typically happen is all of the information that I need to review is going to show up with basically some sort of indicator. And that information can be allergies, meds, That indicator is going to show up down here. This little red bubble is telling me I've got some information to review and merge. Now over on the right-hand side, we would have potentially blue bubbles next to each chart tab to tell you that there's some patient information that was shared with you that's not yet been merged. Now, again, I've chosen to auto merge things into my practice, so I don't have to go through this manual review process. It's just automatically updated. So history is already completed. I've got an orange check mark here letting me know that someone's already done this because they filled out this intake information on the iPad. Okay. But if I was merging, there is just one piece of information that we require to be merged or manually reviewed, which are allergies and medication changes. So in this case, what's happening here is we've got a patient that's made some changes on the intake. They've added Lipitor and they left penicillin on there. So what we're doing is basically an analysis for you and recommending what changes we think you should do. So we think you should add Lipitor. That doesn't seem to be an allergy already on the list, so we think you should add it. Penicillin was sort of already sent over from the intake, but we recognize it's already on the chart, so we're going to ignore the one the patient sent over and just keep what's already on the chart. Same thing's happening with meds. We've chosen to stop this particular drug, add Tylenol, and all these other ones came over as being, the patient was already on them, so we're going to recommend you keep the originals. So all I'm doing is a quick cursory review. If this looks good, I'll hit save. The entire intake patient's chart will now be updated. You can see Lipitor is now on my list. It wasn't before. Tylenol is now on my list, and Cipro is gone. And we've now indicated that all three of these sections have been reviewed by your nursing team. And you can see over on the right, all this information is also updated as well. Okay, so that's essentially, in a nutshell, how the process works. There's one other caveat that I want to kind of talk about that really goes up one level deeper into making this intelligent intake extra intelligent, which is the fact that we can even modify the questions that the patient sees based on one of three things: their gender, their age, or items that are on their problem list. Okay, so if you think about a child, all right, children have different things or different templates or different letters that may need to be signed compared to adults. Maybe you've got a program in place, like maybe you've got a OAB program, and if the patient has OAB on their problem list, one of a certain set of diagnosis, you want them to complete a questionnaire every time they come in to essentially assess how that particular diagnosis is progressing. Some sort of subjective questionnaire with a numerical score that you can track over time. That's certainly an option as well. And obviously, if the patient is a male versus a female, there's different questions that are going to be relevant, especially as you think about the ROS and even potentially the history as well. So all those things can be incorporated into the process so that the right patient is getting the right information at the right time, and really eliminating that burden that you as a practice have on making sure they're getting the right things based on the policies that you've dictated as a practice. Okay. So big picture, that is how the process works. I do want to go one level deeper and just talk about a few of the setup items to kind of bring some of these concepts together for you. So all of the setup is done over here under the setup screen and then intake setup. So the first thing that you'll notice is you have the ability to create as many intakes as you think necessary to really kind of get your practice to handle the different scenarios that your practice runs into. So if I just select this follow-up visit intake, you can see how I've chosen to configure this. First off, this is the name of it. This is a little description that I use just internally to let my team know how and why we use this. And then here are the instructions that I want my patients to see when they open the intake. Then I want them to complete demographics. So I've chosen to turn this on. And then here are all the fields that we can allow the patient to fill out. If going forward, I decide, you know what, it's really not relevant for me to capture, maybe I am the PCP, right? So I don't want to capture a PCP. And therefore I probably don't have a referring provider. So I want to go ahead and turn that off. Those things aren't relevant to my practice. I don't need that. Okay. But I've noticed patients aren't filling out their marital status. And I think that's really critical for me to do business. So I'm going to make that a required field. Same thing with responsible party. Do you want to collect it? And if you do, what details do you want to collect? Oh, the relationship is required for claims to go out the door? Well, let's go ahead and make that required. Here's my emergency contact, right? What things do I want made available there as well? And also, I forgot to mention as I was going through these, notice I've chosen to auto merge or not section by section. Okay, so this is how you can really control what patients can update without you reviewing it versus what things you need to review ahead of time. If I was a practice using appointment reminders, I could turn that on as well. This would allow your patients to input, what their preferred way of being reminded is, phone, text, or email, and then what phone number should be used for a phone call or a text, and what should be used for an email. All right, those things can be updated there. Then I can turn on if I collect copay or not, outstanding balance or not. Remember, you've got to have the Pay Simple integration set up to do that for credit card processing. Do I want a photo ID? And if so, where do I want that to go inside of my e-document section? If I collect insurance cards, where do I save insurance cards at? All right, every practice can have a different folder, drawer, cabinet type structure to store that information. Do I want allergies? Yes or no? Is it required? Do I want meds? Yes or no? Is it required? Here are all the templates that I've chosen to fill out, all right? Or I've asked the patient to fill out. Do these things get auto merged? History did. ROS would not have if I was prompting the patient to fill that out. Letters, here are all the letters that we want to be signed. And then last but not least, do we want patients to input their pharmacies? And then once we have all this configured, we can turn on our communication preferences. So these things I think are really critical. So basically there's two types of communications. There's the first one, and then there's all the follow-up. The first one would occur in one of three scenarios. Either never, which means you never want to send an email to the patient letting them know to fill this out, or immediately when the intake is signed. So let's imagine you assign an intake right now, then tonight, no matter when the appointment is, they're going to get a reminder to go fill that information out. Or this is the option that I think is the best, X number of days prior to the due date. So for example, let's imagine you're scheduling appointments a year in advance, okay? Well, I don't really want my patients filling out the reviewer systems. I don't want them making payments. I don't want them doing a lot of things 365 days before they're coming into my practice. So many things can change within that window. It doesn't make sense for patients to go complete that information ahead of time. But maybe 7 days prior to the appointment or 14 days prior to the appointment starts to feel a little bit more valid to me, okay? So every night we're gonna go out and check, okay, what intakes are sitting out there, who needs to get a reminder, and we send them a reminder automatically. And then once they do get the first reminder, when do we follow up? Do we ever follow up, or is it every X number of days after the first communication? Maybe, so if I ask them to fill it out 14 days ahead of time, I'm gonna remind them every 2 days until they finish it. Again, completely up to you on what you want those preferences to be, but the goal here is to get them to fill this out. One point I want to make about the communication is that the patient has to already be set up with my medical locker to get these communications, all right? So it should be part of your workflow of creating a patient to make sure that they're connected to MML, and if not, register, connect them. That way we know who to send the messages to. So as a reminder, when patients connect to MML, they're using a phone number or an email address. So however they've chosen to connect to MML is how they will be communicated with to complete the intakes. Two other things I want to look at from a setup standpoint. Letters. I think the concept of the letter setup is really critical here. So I mentioned there's some intelligence built into this process as well. So if I have this patient consent letter, now I need to make a decision on when it is filled out, okay? First off, I'm gonna have it as made available as part of my intake. And then when do I want it to be signed? Should it be done every 12 months, for example? Maybe a consent to treat makes sense to be every 12 months. Or there might be another scenario where you update your privacy policies, right? And you want every patient coming in after you've updated them to sign this new letter. So after a certain date, all right? And then also, if they do sign this particular letter, do we want that to automatically check the signature on file box within patient setup. So that's one of the things that you have to have in order to get claims out the door. We know that usually is coming from a patient reviewing some sort of financial policies. So basically, by checking this box, when they sign this particular letter, it will go update the signature on file date for you automatically. So that's another part of the setup that is really critical. And the last thing I want to look at is how you assign these intakes to an actual appointment type so that these are auto assigned. So under the appointment type setup window itself, for each one of your appointment types, you'll make a decision on which intake they get access to. So if my patient's coming in for, let's just say this abdominal exploration, I would click on that. And then once this loads up here, I'll be able to go select the intake that I would like to ultimately assign to that particular appointment type. Okay. So those are really all of the, there we go. So there's that intake screen right down here. So for that particular appointment, maybe I'll assign them the follow-up, save that off, and we're good to go. Okay. So that is how some of the key things about the intake process itself. Now, I'm going to go ahead and shut up for a little bit, take some questions, and answer anything that you might have. As a reminder, there's a chat panel there on the right-hand side of your screen. Feel free to ask any questions that you have. All right, looks like we've got a few here. All right, so the first question is, under the medical history section, can you customize which sections are included? For example, for a behavioral health clinic, we may not want all the medical pieces, just some. Absolutely. So that's one thing I should really kind of dive into a little bit more, is the concept of building this out. Typically, when you sign up for this, you're going to go through sort of a little mini implementation. Every practice is so different. Every intake process is so different. And our team will really work with you hand in hand to understand, okay, for this type of patient, what things do they need to fill out? So let me dig into the template setup thing really quick, because I think that's a somewhat confusing concept. So if I go over to templates in this particular practice, now just know everything that I'm showing you right now could look different for your practice. I'm going to open up the history template for just a second, okay? And let's just imagine this is the history template that my practice uses. Let me just show you what this one looks like. Notice for this particular practice, this is the big template. Here are all of the various categories that exist on the practice history template, the thing that the providers and the medical staff fill out. There's like 25 sections here, okay? However, when I want my patients to fill it out, I don't want them to have access to every single question and field that's available. So what we do as part of the build process is we create an intake template, right? And the intake template is called medical history. And those things only have these 4 categories. And within inside of these categories, and sorry, I'm getting to some of the build stuff, these are the options that are made available. Those then, in one way or another, will map to something on your medical history template. Notice these 2 things look different. This is the practice version. This is the patient version. Not everything exists here, right? It's just, we create a mapping. Anemia probably goes to anemia, asthma to asthma, but this could be a more or less complex as necessary. So we're really building the intake template to match and map to your EMR templates. Great, great question. All right, so the next question, is this setup user-friendly enough to complete via smartphone rather than a computer? The answer to that is yes. So my medical locker and the intake are both mobile-friendly applications. You can absolutely complete these using your phone. I personally think it's a better experience completing, like if you're gonna do this in your office. We do have some practices where they've chosen not to purchase, a couple of iPads, and they basically say, hey, patient, go to this website on your phone, enter this code, and you can go sit back in your chair and complete this from your phone. It absolutely does work. And there's, a couple advantages, right? Taking pictures of your insurance cards or your driver's license is pretty easy to do on your phone. So it absolutely works. It's just, it obviously is a smaller screen, and it's up to you. And, you understand your patient population better than we would, but it will work. All right, so does the information, another question is, does the insurance information autofill based on the photo, or is that a manual process? Okay, great question. Right now, that is just, the picture is coming over. Just like if a patient handed you their insurance card and you scanned it in, you do still have to add the insurance information into iSalus today. That is something that we're looking to do down the line, probably early next year, where patients can actually input their insurance information. We just ran into a lot of roadblocks where, you know, Anthem to you is different than Anthem to every other patient in practice, and making sure the right insurance plan gets selected is a really critical function. And right now we don't have a great way for patients to get that exactly correct every time. So practices will be required to review those insurance cards and then ultimately update the insurance as a result. Okay, so the next question is, so do you assign the MML key when you do an intake over the phone and schedule the first appointment? So I think the question is really related to what is the right workflow to get a patient connected to MML so that they can complete their intakes at home prior to the appointment. So let me kind of go over to the iScheduler here and demonstrate this a little bit. So if I were a practice, I would have a policy basically where anytime I schedule an appointment, I would want to in fact verify that that patient has an MML account or not. And if they don't, I would basically make it part of the appointment creation process to get an MML account. So if I were over here and I was, if Blake Head was coming into my practice, select him. First thing I'm going to do is schedule the appointment. Okay, that appointment's now scheduled. Then what I would want to do quickly is check to this patient's MML connection status. So I'm going to go to My Medical Locker Admin. So in this case, this patient is not yet set up. So I would go ahead right here, connect this patient. And there's a number of ways that you can connect patients. You can do it through a process where if you have the patient on the phone right now, you can basically send that patient a text or an email, and they're still on the phone with you. So you text them a token, they get that text, they read it back to you, you put that code into here. So I actually got a text on my own phone. Let's see, 82222 connect. Now that patient now will be connected to MML. They get a text message with all the instructions to log in. And because I now have an MML account, I'm going to get those communication reminders, and I'm going to be able to log in and see those intakes ahead of time. All right. So that's one way to connect your patients. The other way, if I go back to this connect option, is let's just say you don't want to sit around waiting for the patient and you don't want to be on the phone with them while they're trying to get this token and read it back to you. You could just simply send them their connection key. All right. So this is not a connection key for their intake. This is a connection key to get them connected to an MML account so that they can complete the intake at home. So in this case, you just put in the phone number that you want to send the key to, they get a text with the information, and it basically gives them instructions on how to go create an account and connect it to this page to your practice. Okay. Great questions. One other thing I'll point out, because we have built this into the workflow, let's imagine a brand new patient is coming in, okay? So we got Bill Bob here. If I create Bill Bob as a new patient and fill all this out, we have basically built the ability right into here to not only create the patient, but then to jump into the MML account process at the same time. So if you hit create-MML here, it creates that patient and opens up that My Medical Locker assignment window we just looked at, and we just connect them just like we just did without having to kind of remember where to go to get to the screen. So for new patients, that's a really helpful workflow. Okay, question is a iSalus portal app in the works instead of having to visit a web page? So there's kind of 2 points there. For the patients filling out, going to My Medical Locker, we actually used to have a patient portal app, and we ended up discontinuing that and really replacing that with a mobile-friendly website. So rather than having an app on your phone or having to go to the App Store, which is proving quite challenging for a lot of patients, they just simply have to go to the URL. It's built to work just like an app. There's actually special code that we've written where when you open up My Medical Locker on a phone that supports it, you can say add to home screen, and it adds a little badge that looks like an app and works just like an app. It works less like a website and more like an app. It's some new cutting edge technology that we've implemented here. So patients have access to it that way. All right, the next question is, what is the cost for this service? So this is billed out on a monthly basis based on the number of providers in your practice. And I believe the current rate is $95 per hour. I'm going to apologize, I'm the worst with the financial side of this. So ultimately, if you are interested, you can get signed up to talk with one of our team members here, and they'll figure out exactly what the price would be for your practice for the number of providers that you have. All right, then we have another question here. Can you set the pic to upload to only ask for driver's license? We wouldn't want a photo of the patient. So right now, it doesn't have the ability to kind of change the language at that level. However, some practices have gotten around this by including in their instructions when they're filling out the intake to upload a driver's license rather than a photo. It's not a foolproof way. It won't guarantee that you get it, but that is a solution that some groups have implemented. All right, so the next question is, what happens when an adult child is connected to a parent and then needs to connect as a patient? So there's a couple ways that that can be managed. So if the patient, so I think what you're getting at is My Medical Locker allows sort of this structure to add family members, okay? So if I, Ben, am a patient and I add a family member who's also a patient, I can certainly do that, okay? So I'd fill all this stuff out. Now, once this was filled out, I can also choose to create a login for that family member where they can access MML independently of going through my Ben Jones account, and they can access themselves, even though Ben is sort of the quote unquote parent, still overall manages this account. Once this individual account is created, they can then also connect to any patient record that uses iSalus as well. Great questions. All right, just kind of skimming through here. I think I have answered all of the questions that have come in so far. Any other questions? Okay, here's a great one. So if a patient made a payment via MML, how is that being linked to iSalus? Really great question. So basically, if you use the payment integration for iSalus, there's a number of ways that patients can then start to pay you with their credit card. And every single one of them is integrated back into the billing system. So like as an example, you saw that through the intake, I can make payments. You've seen also from MML, patients can make payments just by looking at their account balance here, right? So I could just go simply look at my statement history, look at my account history, for example, and then choose to go ahead and make a payment. So if I hit make a payment here, then I'm going through that same process. Also, with our next release coming out on Thursday, we're implementing a new statement vendor called Dr. First, which will allow your patients to actually pay through your website, via text, via email, through a number of ways. They're going to be able to pay their statement outside of MML, right? So all those things are going to exist. Then also within iSalus, you can take payments over the phone via credit card. So you can just, if a patient calls up, wants to make a payment, you can put that information in here and take a payment as well. Every one of these scenarios creates a payment record with basically a receipt inside of the account. So if I go over to billing, for example, that receipt is going to show up in the receipts tab. And part of the normal workflow when a receipt is collected, we will try to automatically apply that receipt to the appropriate claims for the patient. So we're going to try to turn that receipt into a payment record. If it's copay, It's going to look for example, a claim on that same day of the appointment and figure out which procedures to assign that dollar amount to. If it can't find a payment, if it can't find a claim, then it goes into a hold status, and through a series of days, maybe 7 days, maybe 14 days, depending on your settings in your practice, we're going to attempt to find that claim and apply it. Eventually, if we can't find a claim, it creates an error. If it's an outstanding balance payment, then we're basically working oldest to newest. So we're looking at an outstanding balance the patient has. Maybe it's $1,000, they pay 200 of it. Those $200 get automatically applied to the oldest balances, and it moves up to the earliest balances. Okay. So hopefully that answered your question there. Another question, are we recording this? Yes, we are recording this, and anybody that's registered will get an email, I think about this time tomorrow, with a link to this recording. Another question is, do you have to be using the EMR to use the service, or can you use this with billing only? Yeah, you do not have to be using the EMR. The EMR is sort of an added component, right? If you are using the EMR, there's a lot of clinical information you're probably wanting to capture for your MAs, but if not a problem, right? You saw through the intake setup how you can turn on section by section. So you only have to turn on the sections that are relevant to your practice. Excellent questions. Anything else? We're coming up on time. I've kept you longer than I thought I would, but I appreciate all of the good questions here. I'm going to hang out for until 1 o'clock, so feel free to ask any additional questions. I will certainly stay on until there are no more, but if you are good, have a great rest of the day. Hopefully this has been helpful, and if you're interested in signing up, reach out to our support team, and they can start to get you some information. There is another question here for those that are still hanging out. Is this applicable for behavioral health assessments as well? Yes, this is applicable really for absolutely any questionnaire that you want your patients to fill out. If we can build it as a template in iSalus, you can make that template available to your patients as part of the intake. That is not a problem. You wouldn't believe some of the workflows and scenarios we've been able to accommodate over the last year or so as practices have been implementing this. As I mentioned, in April alone, we did 133,000 of these intakes. As you can imagine, every patient's different, every practice is different. We've been able to accommodate those workflows anywhere from behavioral health to urology, nephrology, ENT, internal medicine, podiatry. I mean, just about every group has been able to implement this in one way or another to meet the needs of their practice. Right. Any other last minute questions that I can help answer here? All right. Looks like we've got just about all the questions answered. For everyone that's stuck around here, thank you so much. Have a great rest of your day, and we look forward to working with you on this. Thank you.